In ladies presenting with polycystic ovary syndrome, it usually at the age below 40, when no one is expecting her to be having malignancy of the endometrium, they can present with CA endometrium by a change in pattern of menstrual bleeding. We know that this is an oligomenoric or amenorrheic state. When a lady having PCOS and present below the age of 40 with a changing pattern of menstrual bleeding, we have to suspect this lady might be having an abnormal proliferation of the endometrium. We have to tell our frontliners about that and take a biopsy from the endometrium.
Especially with if there is a long period of amenorrhea.
Yes, and the increased amount and frequency and so on.
Okay.
Thank you.
Thank you.
أعتقد كمان دكتورة سحر إحنا بنعتمد على الاندوميتريال ثيكنس خاصة في البي سي أو إنه الكات أوف 7 ملم or more.
So Mohammed, this is the shortest presentation ever. I believe our audience are shocked. Okay, it just ends in 10 minutes. Okay, so 15 minutes. Okay, but we have 1 hour usually for discussions and for all of this. So I'll have the floor open for discussion from our virtual attendees, or if anyone wants to add something. Dr. Amr, Dr. Sahar, please moderate because I have to be in another meeting right now. And you have the questions for our virtual attendees through the Q&A box, and you have the time because we are so early. We need to discuss more.
ما في سؤال؟ Hello. Our virtual attendees, do you have any questions, please? You are welcome to shoot questions.
Hello, doctors. Thank you for Dr. Mohammed about
asking them.
Okay. I want to ask about bleeding, how to differentiate between bleeding coming from endometrial TA or another type of abnormal uterine bleeding.
Bleeding from endometrial or?
Is that something special for endometrial CA?
Please, we cannot hear your voice. Can you please raise up your voice so that our lecturer will answer you? تفضل دكتور.
You can listen to me?
Yes.
Okay.
Okay, my question is about bleeding. Is that anything special for bleeding coming from endometrial CA?
No.
Maybe it will be a bit darker.
No, it's
post-menopausal
bleeding is biopsied after
cannot differentiate by the button.
after measuring the endometrial thickness, but perimenopausal bleeding or abnormal uterine bleeding in childbearing period, there is no difference between bleeding from endometrial cancer and other bleeding.
Any more questions, please?
Okay, what about diagnosis of endometrial CA? The lecture will هل يتضمن شرح الكلام هذا من ضمن الدياغنوزيس من ضمن الليكتشر or no?
No, next lecture.
No, the diagnosis and clinical presentation, symptoms and workup will be next lecture, inshallah.
Okay, thank you, doctor.
Thank you for participation. Thank you very much.
Okay.
Any more question?
I'd like to comment upon the type 2 C endometrium, which is not based upon having hyperplasia of the endometrium. It's based upon having atrophic endometrium. That's why sometimes it's not expected because the patient is having a thin endometrium in ultrasound, but still she's having the bleeds, which does not go with having a thin endometrium. Yet we have to look and suspect this might be a type 2 CA endometrium.
So I don't have any more questions from our audience. Really, it was a very short presentation. Mohammed, I know this is your first presentation in our program, and really it's my mistake. It's not yours, because I had to revise and I had to add more, because it's a great effort, really, but this is more or less an undergraduate presentation. So we need something when we are going to fellows. You should have gone through the main textbooks of gynecology, up to date, ESGO textbook, something like that. You will find much more data about this. Okay. So I'll be waiting for another presentation. I will upload this one for the undergraduate, but I'm waiting for you to record another one for the postgraduate about this. But really, thank you for coming here today. I'm very happy for this. Okay, and again, sorry, because you sent it for me. I had to revise and I had to put my input, but I was so busy. So this is mine, and thanks for our audience for being here. I think the audience are happy that we finished early, and I believe that next week we'll have a much longer presentation. So thank you for all being here. Thanks for Yasser, Wael, and Salma. Thanks for Handy, Ezra, and thanks for everyone who was online. And let's meet next week with a much longer presentation. And Mohammed will promise us with another presentation that he will record and we will upload for our website. Thank you, Mohammed.